Health and education are critical components to social mobility, and health is a basic human right. So what could be more important? And to help us in that debate, we have here all of you, enormous intellectual capital, expertise and wisdom, to help us in this debate and get closer to achieving our visions. There's no doubt that we've taken already some truly bold initiatives in health, but there's a long way to go. There's several groups involved in this journey. There's the role of the university, that's us, educating the next generation of health professionals, and that's a really quick way to change culture. There's the role of industry, which includes all of the health sector, and then there's my particular interest, allied health.
Look, there's been an enormous focus on the supply side of healthcare, but I don't think we've focused greatly on demand side. We don't really yet understand why there's an almost irrational demand for healthcare when you're sick, but when you're not sick, the appetite on the demand side for just good health isn't very high.
So if there was public funding for many of the allied health services, we will prevent so much down the track. Instead of waiting till people are really sick and have to go to hospital, which is really expensive, we could keep them out of hospital.
And we're seeing lots and lots of money pour into the hospital system. That's growing at a much faster rate than what we're spending in terms of trying to keep people healthy and out of hospital.
Right, but if you just think of children 3-4 years old with a speech disorder, okay? Speech pathology at that stage can cure it. I'm not allowed to talk about cure, but I do. You can cure it. What happens then is that they can learn. If you don't treat it at that stage, they can't learn. There's literacy problems. There start to be problems with being bullied at school. They leave school, they drop out, and there's a high rate of incarceration. Simple little, quite cheap treatment, speech pathology, 3-4-year-olds. But if you can't afford it, it's not available.
I think if you look at the consumer experience of healthcare, it's extremely fragmented. Consumers face barriers to access, which may be cost-related, may be geographical, may be cultural. We know that Indigenous people face significant barriers in accessing healthcare still. So there are barriers to access. When people do start to access the health system, it is highly fragmented. We've got poor communication systems. The various players, primary, secondary, tertiary, public, private, they don't talk to each other very well.
I think you'd say the health insurance industry's been a little bit slow in getting its act together, but ultimately where it needs to go is to be able to engage people in health, be able to have a relationship probably with primary care, which has been incredibly difficult because of the boundary between Medicare funded things and what health insurers can do. And ultimately help people kind of find their way through the system, which is one of the hardest things.
I want to redesign the health system, starting with the patient in the middle, okay? Not the IT system, not the financial system. Let's start with the consumer.
I just wanted to mention the My Health record, which is coming along in leaps and bounds. And now that we're able to, or very soon able to, get the PBS and the MBS information accessible to digging down in the My Health record, this is going to be quite revolutionary.
And certainly we found having the opportunity to provide an electronic health record around which primary care and allied health work together with some of the multidisciplinary teams for some of the more complex case made a big difference in terms of helping people manage their own conditions.
This is going to be the century of the consumer, believe it or not. I mean, health will not be able to stand outside all of the trends that have happened in other services. And so I think you will see consumers getting a lot more ability to figure out what that information means and support when they're actually making decisions.
I feel we're talking about the next 5 years, but we need to be thinking 20 to 40, and this is going to be completely disrupted, okay? Consumers are going to take control, and it's incredibly patronising to be talking about who's going to be care coordinating. We have an agency problem where the government pays $160 billion every year for your health to be looked after by other people. I don't think consumers will take that for very much longer when they have the power to determine where risk and responsibility are going to fall.
Let's concentrate on addressing how to make the last couple of years of life better, both for the patient and for the public purse in the system.
In Western Sydney and now in many other health areas around Australia, people are developing community health pathways. So community health pathways are web-based, they're accessible from the GP's desktop, or in fact from any health provider's desktop in the region, and they provide evidence-based guidance. We're currently up to about 350 different conditions in Western Sydney.
However, I think there will be, and hopefully there will be, increasing consumer pressure to make information and transparency of the system much better than it is today, including provider performance as part of that.
Yep.
The information there'll be more credibility, there'll be brokers acting for consumers to give them much more sense of whether what they're being told is kosher. So I think the digital revolution will make information and how it's interpreted much more even between consumers and providers of care.
Digital revolution is really important, but I think funding might be the beautiful crisis that we need to really kick in and make us actually change. If there's no money, we have to do it differently, and we can do it fantastically well. Thank you very much. Thank you all for your wisdom, and I hope that you keep the conversation going, because we're going to solve it. And we haven't done it today, so we'll have to have another one next year. So see you all then. Thank you. Thank you.